This is Telehealth Tuesday, and my name is Dr. Michael Bookhart with Good Faith Wellness Center. This is a practice, a multidisciplinary practice that we have started just late last year. Myself, Dr. Torrance Green, who's a board-certified nephrologist and internal medicine doctor, and also Dr. Sophronia Stidwell, certified chiropractor. And we are here to meet all of your primary care and chiropractic needs. Just a little bit about Telehealth Tuesday. This is a weekly podcast every Tuesday at 7 p.m. Central Standard Time from 7 to 8 p.m. And we will be joined by the incomparable Melanie Sanders and also Dr. Temeka Johnson. So we want to give you a little bit of bio on them, just to give you some background on these two amazing guests. So let's tell you about Dr. Temeka Johnson. And this is also somebody that I know personally. And she's been a wonderful doctor, a wonderful person to work with, and she cares about her patients deeply. We first met at Mary Health Hospital at River Oaks in Flowood. Dr. Johnson is a Southwest Georgia native and one of the founding partners of Lakeland Premier Women's Clinic in Flowood, Mississippi. Dr. Johnson actually graduated magna cum laude with a BS degree in biology from Albany State College. And also she earned her MD from Morehouse School of Medicine. Shout out to Morehouse. Dr. Johnson completed her OBGYN residency at Wayne State University, Huntsville Hospital, where she was also recognized for her excellence in student education. Dr. Johnson is a proud Christian and member of the Delta Sigma Theta Sorority Incorporated. Dr. Johnson enjoys public speaking and educating young girls and women about their health. She also let us know that from the age of 5, she wanted to be an obstetrician gynecologist, and this has been her lifelong career goal. And so that's just a little blurb about her. And again, personally, we've seen her always give her best to her patients. She's deeply committed. Let's go back to Melanie Sanders. Just last week we were on. We had a fantastic time. And the other reason why, even though next week is Breast Cancer Awareness Month, and we're hoping to have another partner from Lakeland Premier to join us, we won't say who that is, you just got to stay tuned. But we wanted to make sure to include Dr. Temeka Johnson, because this is such an important time, such an important topic. And you all know, everybody who was tuning in last week, you all remember that we were discussing fibroids, fibroid tumor, which is benign tumor, and in the myometrium layer of the uterus. And so we had several young ladies who were asking questions. We had, I think, a couple of people who were actually people who had been diagnosed with uterine fibroid disease. We had a couple of young ladies that were very educated on this and were asking pointed questions. And I said, even though we have a wealth of knowledge on this topic, let me get the expert in, the person that you really need to ask these questions to. And so that's what we did. We had an outpouring of support, an overwhelming amount of support and inquiries and interest in this. And so that's why Dr. Johnson has, graciously accepted the call. Anyway, going back to Melanie Sanders. So again, she was there last week. She'll join us in a few moments. Melanie Sanders is a former American Idol finalist and Miss Atlanta, and also was previously Miss Atlanta. She has created a company called Lux Life, which is a boutique firm blending her expertise in entertainment, sales, and public relations. As a teenager, Melanie appeared on the Oprah Winfrey Show, which inspired her to pursue her dreams. Melanie's singing talent led her to immense success in pageantry and also a spot on American Idol, where she performed for millions and at the MGM Grand in Las Vegas. She toured with the Spelman Jazz Ensemble. She did graduate from Spelman College, shout out to Spelman, and starred in independent films and Showtime's The Chi. Recognized by the Georgia State Senate, Melanie continues to make an impact through Lux Life and her community work, and we thank her for that. Thank y'all so much for joining. Let's get right into it. Okay. How are y'all doing today?
Doing bad.
Overworked.
but I'm here. Thank
Dr.
God.
Johnson, you had to do a surgery today?
I did a C-section right before I went and caught a baby, ran out the hospital wide open, and I'm here. Struggling, but I'm here. Yeah.
Ooh, I want to talk about all that, but go ahead.
No, no.
Oh my goodness.
Yeah, I was telling everybody out there in podcast land that we would try to finish at 7:59, so because I know everybody is just so eager to get to this debate.
The
But
debate.
yeah, we'll see how it goes. Dr. Johnson, we
Yeah.
had several questions, and even Melanie herself was chiming in, and a couple of friends of hers about uterine fibroids, and
Yes.
everybody they were asking, are they more prevalent in African Americans? They were asking why is that, and they were also asking what are the options in management of uterine fibroids.
Okay. All
Thank
right. You want me to just
Uh,
jump in?
Yes.
Sure, yes, ma'am,
Yes.
sure,
Uterine
please.
fibroids, which are just benign muscle tumors of the uterus. And, there's a less than 1% chance that they can become cancerous. So rarely are they cancerous. When they do become cancerous, that's a leiomyosarcoma. It's very aggressive and it kills you fast. But
Mm,
just benign uterine fibroids, which is probably the most common reason we do hysterectomies, are very common in African American. I can't quote you stats and rates, but I guarantee you I probably do more, probably 80% of my hysterectomies for fibroids are on African American women. I
mm,
don't know why. Um, I I have my theories, but I won't comment on those. I don't want to be depicted as something that I'm not. But we
right.
do, as African Americans, we grow them very large, very multiple.
Mm-hmm.
We're usually very symptomatic. The symptoms of
Mm-hmm.
fibroids historically is heavy vaginal bleeding with and without a cycle. Usually it starts, my cycles are just heavy. I'm passing blood clots. My cycles lasting for 7 days. It may progress to 10 days. You may get to the point where you come in bleeding without stopping. Okay.
Mm.
I've had to do an emergency hysterectomy before. A patient I've been trying to get to have a hysterectomy for years, and she just, kept putting it off. Well, she was at work and began hemorrhaging to the point they called a code on her. They thought
Oh,
they had thought that she had passed the placenta. That's how much clots. Yes. So
Oh
I'm
my
like, why am
goodness.
I stopping my afternoon clinic to run to another hospital to do an emergency hysterectomy for fibroids? So my point to that is that when you are aware that you have fibroids, mainly because of your bleeding, you need to do something. Women put this off for years and years
mm-hmm.
and years because they really don't hurt. It's not pain.
Right.
It's more heavy bleeding. So they're very common in African Americans. I mean, other races have them, but I would bet to say, and I hope there's no other doctor on there to quote me because they're reading stats. I would promise you they're probably 80% more prevalent in African Americans than
Yes.
any other race. Yeah, any other race.
Mm.
Now, I did a talk. I was on, I think, WLBT several years ago now. One of the newscasters wanted to interview me, and one of the things that she had me do research was parabens. Were parabens a cause of
Mm,
fibroids?
Mm.
Parabens are basically what are they, like preservatives. So you find
Okay.
parabens in makeup, you find parabens in hair products. And
Mm.
so they were wondering if could our makeup, could our relaxers, could that be leading more to it? I really let me tell you what my theory is. Let me tell you what my theory. This is crazy. My theory is that as African Americans, everything we do seems to be more aggressive.
Mm.
Okay.
hmm
When we
Mm-hmm.
have diseases,
Yeah.
okay, lupus, high blood pressure, cancer,
Uh-huh.
they tend to be more aggressive.
Uh-huh.
We keloid. As African Americans, we tend to keloid,
Right.
right?
Right.
Keloiding
Right.
is just over healing, over scarring. So I really feel like that uterus is over heal. And after a while, you just get, over whatever multiplication of muscle cells in the
Uh-huh.
uterus and they just grow. And it could be because this, for some of us, it may not be our natural habitat. I mean, I do believe most of us came from Africa. I'm just gonna tell
Right.
you, I do. I believe we came from Africa.
Uh-huh.
I believe we're out of our natural habitat.
Uh-huh.
However, don't look. I done put it out there now, but that's just my theory. Why else would we
Right.
growing like that? you know?
Right.
So anyway, they're very prevalent. The biggest uterus I've ever taken out, this woman's uterus weighed, it was a newborn baby, it weighed 7 pounds.
Oh
It
my
was up to her
good.
xiphoid process. She said she was
Oh,
bigger than she had ever been with any of her pregnancies. So that's probably the biggest one that I've done. It was
Oh my
huge.
God.
Yeah.
yeah.
So anyway,
Oh,
that's on fibroids.
Oh my goodness. Well, I can understand your theory. You're trying to get to the root.
Yeah.
So what is the root of our
Yes.
being? It brings you back home. So
Yes.
and then you just work your way up. So I can understand where your theory is derived.
that's right.
Yeah.
So yeah.
Okay.
Absolutely.
All right.
Absolutely.
Oh,
Wow.
oh my goodness.
Yeah.
Ooh.
This is interesting.
Yeah,
So is it a
absolutely.
way for women to, it's no way that we can prevent because we don't know where it really,
Exactly. You're very smart. That's exactly right, Melanie. When we don't know the etiology or the source,
yeah.
how can we prevent? We can't prevent. We don't. Now, a lot of people will do research on all this holistic. I could have been a DO, Dr. Brookhart. I could have been a
Okay.
DO because I do believe mind, body, soul,
Yeah.
everything relates. And
Yeah.
so I have some patients that will go and do their research on natural remedies, natural things to avoid, certain foods
Mhm.
to avoid, certain
Mhm.
drinks to avoid, certain, but are they, is that valid? I'm not sure. I've had some 2 or 3 very credible patients that
Mhm.
said they changed their diet, they cut out certain things from their diet, and they noticed a difference in their bleeding. Now, it didn't do a whole lot for the size of the fibroids or the number of
Mhm.
fibroids,
Mhm.
but they noticed a
Mhm.
difference in their symptoms. So I definitely think it's worth doing the research. If you say, well, I really don't want surgery, I really don't want all these treatments they're talking about, let me try to do this naturally. I think it's worth a try, you know?
Mhm.
Mm.
Absolutely.
Yeah,
Absolutely.
Oh,
Um,
wow.
yeah.
yeah. Melanie, last time I think there were a couple of young ladies on here. And then, also Dr. Johnson, my own mother, she got on there. She I guess I'm not sure if well, I guess at this point it doesn't matter. She had me
Yeah.
at 41 years old, and
Yes.
but she actually had a myomectomy
Hmm.
before I was born,
Wow,
and so
very
I
good.
was I was commenting on that. Hopefully, I didn't misspeak, but I remember there was a young lady who was asking about that, saying she had gone to a couple of OBGYN physicians, and both of them were recommending hysterectomy. And I said, well, of course, without seeing the records, I mean, I can't comment on their decision for that. But I did say that I know that depending on the size, I said, because we don't know. I said we don't know the extent of their bleeding. We don't know the size of those. We don't know how many fibroids. But I said that I know that I don't see that many myomectomies performed. My mother had one, and then later I was born. So anyway, I just wanted to maybe ask, even from my knowledge, do you perform many myomectomies, or it usually is so severe that they need the hysterectomy?
No,
Oh,
no, absolutely. In a woman who's childbearing age, you definitely don't want to offer hysterectomy off the bat. 30-year-old, multiple fibroids, symptomatic. Absolutely, you want to do a myomectomy if you can help it. If she desires future fertility, she wants babies one day, myomectomy is definitely an option. And I've performed myomectomies for as many as I've taken out 50 to 70 plus fibroids. Look, if one of my patients is
What?
watching this, she may come on and say, that was me, that was me. Because she always reminds me. So she was
Wow.
like my max of like 52 fibroids, like 52. Like we
What?
just take them out, just keep taking them out, taking them out, taking them out. And we always sit
Oh
them
my
down pretty
gosh.
and get a picture for them to see. Now, mind you, myomectomies, in my opinion, is what I tell patients, it's basically reconstructing or plastic surgery of your uterus. Okay. We basically
Okay.
rip that sucker apart, trying not to get into the endometrium, trying not to damage the ovaries, but
Mm-hmm.
we basically, tear it up and get the
Yeah.
fibroids out and repair it. Repair it. Now, the best feeling is when you get somebody full circle. Somebody you've been watching fibroids 29, 30, they hold off and don't want to get a myomectomy. You do a myomectomy 34, 35, their advanced maternal age. You take the
Mm-hmm.
fibroids out. A year or two later, they're pregnant. That's
Oh
beautiful.
man,
That's like,
that's
yes,
awesome.
yes,
Yeah.
this is why I do what I do,
Yeah.
because I helped her. Yeah. Some people you take to the OR for, let me not comment, myomectomy, you be like, you know what? I feel like this is kind of useless, but I always honor the patient's wishes. I mean, if I think it's safe for her,
Yeah.
if that's what she wants, you 45 and you think you want to have some more babies and these fibroids need to come out, I'm going to do it. But I
Right.
let them know, first of all, you got age going against you. Second of all, this is reconstructive surgery. You cannot get pregnant for 6 months after we do a myomectomy. So that's another thing, ladies, you need to know. You need to
Okay.
time it. Don't go and get married knowing you got fibroids and talking about you want to get pregnant the next month. Uh,
That's right.
you know, we
Great
needed to have
point.
been
Great
getting these
point.
out the year before you got pregnant, give you time to heal, and then you go for it.
Okay.
So yes, your mother, especially back then, that was very impressive that she found somebody to do that at the age of 41, however many years ago. I won't
Yeah.
call your age. I won't say your age. You'll tell us, but yeah, that was pretty impressive that she found somebody to do that.
Yeah, that's awesome, man. I
Yeah.
appreciate
Mhm.
that insight. Melanie
Okay.
got a question here. Let's see. Kimo Noel. Hey, my favorite OBGYN, Kimo Noel.
Hey,
Uh,
you know what? I know exactly who
you,
that is.
you know that? Yeah, I was
Oh
just
yeah,
because it's kind of
I
hard for
know.
me to.
I know all my patients.
Okay, all
All
right. Well,
thousands of them. I know
no,
them.
okay. So is menopause still common with a partial hysterectomy? Is menopause still common with a partial hysterectomy, and is it based on age, etc.?
Okay, that's a very, very good question. And that's a very big misunderstanding in the population across the board. Menopause has to do with your ovaries, okay? Has nothing to do with your uterus. Nothing. Your ovaries control everything. I have to explain this every day. Your ovaries control everything. So I could literally go in, take your uterus out, not even tell you, you would not know. Okay? You're over. You still may get moody. You still may gain weight. Your breast may still get tender when it's time for your cycle. Nothing would change other than you would not bleed. Your uterus is to carry babies. That's it. That's it. So when people talk about partial hysterectomy versus a full hysterectomy, that's a layman's term. For us, hysterectomy is uterus. Now, when you take ovaries out, that's an oophorectomy.
Mhm.
Okay, we don't always go and do a total hysterectomy and bilateral oophorectomy, or whatever. We don't really take ovaries out unless there's a reason for it. I mean, some women come in and say, "Look, I want all this out because I'm not coming back." Okay, that's fine.
Right,
But
right.
if I take your ovaries, at that point you are in menopause. Okay, if I take your ovaries, you are in menopause. But if I leave your ovaries and only take your uterus, if you weren't of menopausal age, you won't be in menopause. The average age of menopause is 51. Okay. Some women may go into menopause earlier than 51. Some may go a little bit later than 51. And that's another thing about African American women. We tend to have longer cycles. We tend to bleed till 52, maybe 53.
Mhm.
Drives me crazy, but we do. But no, get it straight, people. Just taking your uterus, just a hysterectomy, will not put you in menopause unless you were about to be in menopause anyway. If you're 45 and you
Mhm.
have a hysterectomy, but I don't take your ovaries, you're not in menopause. You're not. Your ovaries is what controls menopause. Menopause is ovarian failure. Your ovaries stop working. Okay, so as long as they're there and they're healthy and they're working, you will not be in menopause.
Hmm.
Mm,
Okay.
mm.
Let me see if did y'all get all that?
That's very important. That's probably the most common what's the word, myth or
Hmm.
miseducation that people have, is that when you have hysterectomy you're in menopause. No, no,
Hmm.
no.
Well, I appreciate you clearing that up. Noel said, so these hot flashes at night are in my head. LOL. Thank you.
No, actually, you can begin having menopausal symptoms starting as early as in your early 40s. And that's called perimenopausal. Okay, so you're premenopausal, perimenopausal, then menopausal. Those are the stages in a woman's life. Premenopausal is your early years. While you're having cycles, while you're having babies. Okay. Perimenopausal usually starts about in your 40s. Okay, and at that time you can start experiencing hot flashes, night sweats. You may even start skipping a period or two. Okay, but don't get excited, because that can last until you are 51, and at which point you may become menopausal. Menopause is indicated when you go a full year without a cycle. Hear me out, ladies. You go a full year without a cycle. That is technically menopause. In the menopausal age. Now, there are some women who say, well, I mean, I'm 35 and I went, a year without a cycle. That could be premature ovarian failure, but that would need a workup because that's out of the norm. That's not typical.
Ladies and gentlemen, this is Telehealth Tuesday. We are live on Facebook Live. Well, tonight we will definitely be on a different platform next Tuesday, 7 p.m. Central Standard Time, 7 p.m. to 8 p.m. I know we'll go a little bit over today because, maybe, and who knows, maybe if Dr. Johnson and Melanie are gracious enough to join us very soon on another week, y'all, because some of y'all, I know there were a lot of people on earlier. We might have missed some questions. But anyway, Telehealth Tuesday, every Tuesday, 7 to 8 p.m. Central Standard Time. My name is Dr. Michael Bookhart, one of the hosts of this wonderful podcast. And we're joined by Dr. Johnson. We have Dr. Temeka Johnson of Lakeland Premier. Right there in the middle, we have the incomparable Melanie Sanders over to my right and probably your left. And again, they have graciously joined us on Telehealth Tuesday. All right, so we have been talking about different conditions that plague the African American female community. We have been on the topic of uterine fibroids. We have talked about the surgical components to that and how to approach it. Dr. Johnson has educated us on the fact that African Americans are, roughly 75 to 80%. In her experience, in her practice, that's what she's been seeing with these fibroids. We also talked about the number is 52, that you've removed up to 52 fibroids. That's got to be a world record.
52. No, it's not.
Yeah.
No, it's
Not
not.
a
One of
world
my
record.
partners did 70
Oh
plus.
my
See, I was trying to let you be great.
No,
I'm trying to let you be great.
I can't be great. I can't be great.
Oh, you
We're
can't be
talking
great.
about at one time.
One surgery, probably about 2-3 hours.
Oh my God.
72. Dr. Frida Bush, I don't know I'm sure many people have heard of Dr. Frida Bush.
Absolutely.
She was the fibroid queen, the myomectomy queen. She did, I think, 70 plus fibroids before.
Wow.
Now, mind you, that's a lot of blood loss.
That's a lot.
Those patients often will need blood transfusions after we're done. It's major. It's much easier just to do a hysterectomy and be done. You're talking about an hour less, you're done. But to go in and individually take out all those fibroids, that's a lot. Yeah. And there are medicines that we can give to decrease the blood flow and decrease the blood loss during the surgery, but it's pretty significant.
Yeah, absolutely. Wow, that is amazing. Well, we've got Shawnice. Shawnice is asking, good evening, everyone. Would getting a myomectomy cause fibroids to grow back once they're removed?
They can always grow back. Having a myomectomy does not put you at higher risk of growing them back, but they just grow back. I mean, they just come back. Until you hit menopause, they continue to grow and they will continue to come. So having a myomectomy, while it is a treatment, it's not a cure. Does that make sense? Like, it helps with your symptoms and help with what's going on at the present, but it's not a cure. So, sadly enough, I've seen a couple of women in my career that had a myomectomy. Well, within 3 to 5 years, their uterus is back as big as it was with a whole bunch of fibroids. Okay. I don't like to do repeat myomectomies. I don't. I have a partner who does not mind. I don't like it. You're dealing with scar tissue. And the fact that they came back so fast, I'm like, I don't like continue to put you through that. I mean, you're talking these women in the hospital 2 to 3 days, potentially blood transfused. So it's pretty serious. I mean, I've done repeats before, but I'm not crazy about those,
Oh my God.
Yeah.
So when it comes to pregnancy and fibroids, it doesn't matter where they are, or
Okay, so as far as getting pregnant, getting pregnant doesn't seem to be a problem, believe it or not. I have a patient right now who she had one when she first got pregnant. It might have been 5 centimeters sitting down in her lower uterine segment. Well, by the time she's 24 weeks, I'm doing the exam and she's complaining of pressure. This thing is doubled in size. So pregnancy can make them increase in size. Another thing pregnancy can do is when you're pregnant with fibroids, these fibroids can degenerate. Sometimes they grow and the uterus and the baby is trying to take all the blood. So it could deprive the
Okay.
fibroids of their blood flow, so then they can degenerate.
Okay.
That's painful. I dealt with a lot of those in residency. I hadn't seen it as much in private practice, but they can degenerate, and mainly it just causes pain. Rarely do they cause preterm labor, or it's not gonna, the baby will continue to grow. You just gonna be big, like you gonna look. By the
Oh,
time you 20 weeks, you might look like your term, depending on how many you have or how big
oh
they are.
Lord have mercy.
Let me
my
tell you a
God.
funny story. Let me tell you a funny story. We did a C-section on a
Beautiful.
patient. She had so many fibroids before she even got pregnant. Like, I was surprised she got pregnant, because like with that many fibroids, it's like, where's the
Yeah.
baby going to implant?
Where?
She had,
Yeah.
Oh
yeah.
my God.
So she did. She got pregnant. She carried this baby to term. I helped my partner do it. Wasn't my patient. That doesn't matter. But I helped my partner do the C-section. Y'all, literally, when we cut into this woman's uterus, my partner dug around for like, she had to get down past the fibroids to try to find a baby. It literally
Oh,
took us
mercy.
10 minutes. Like, when we make that incision on that uterus,
Oh,
that
that's
baby's out in seconds.
oh, that baby
Okay,
got to come
seconds.
out.
It's out. Literally, we dug around in that woman's uterus for y'all. I promise you, it seemed like forever. And my partner was finally like, "I got the baby." I'm like, "Thank God." I mean, literally, I was
Oh
like, "Are
my
you sure?"
God.
As she was working, I'm like, "Are you sure this woman is pregnant? Did we just do a C-section on a postpartum patient? Like, what
Wow.
the
Why
heck?"
they did
Yeah, that's the most impressive one I've ever done a C-section on. I was like, my partner, when she finally found a leg or a head or whatever, she was like, "I got the baby." I
Oh my
was like,
God.
everybody I was like, "Thank you, God." Because I'm like, I was starting to think this woman want full-term baby. But her
Lord have
uterus was so
mercy.
big,
I need
so
to say,
thick,
why they
so
didn't
many
cut it?
fibroids. It was a struggle. Yeah.
This
So
is
that's
this is
yeah.
yeah.
Oh,
Oh my God. Have you ever had
why
a
didn't
surgery that almost like wiped you out, like you couldn't even hardly handle it? It was just so I mean, either it was gruesome or it was complicated or whatever the case, where you were just like overwhelmed to the point where it was like, what do I do?
Um, no, that's rare. And I'm not bragging on me. Oftentimes when we do majors, we work in pairs.
Okay.
Okay. Two eyes are, I mean, four sets, four
Yeah.
eyes, two sets of eyes are better than. So usually when we do majors, we kind of work in pairs.
Okay.
So, you got two OBGYNs who've been practicing for double digit years. We're going to get some stuff figured out.
Gotcha.
Okay. We're going to figure it out. But another thing we can also do, if we come into something that's really, really complicated, like dealing with intestine or,
Yes.
bowel all wrapped around, we can call the general surgeons. They're always around. They're like cowboys. I love general surgeons. I should have been one.
Wow.
But they'll come in and they'll do, and we talk, and sometimes we'll talk them through. No, don't bother that. Don't touch that. Don't touch. So it's
Oh,
like a team effort. So, my thing is, one of my patients' husband told me one time, he said, "Dr. Johnson, you know what? I said, what? He said, you seem like you ain't gonna let nobody die." I said, I said, "I promise you, with God's grace, I'm gonna try not to." But things happen. Things happen. That's why it's called practicing medicine. My
yes.
oldest partner, Frida Bush, God bless her soul, she died in January 23. She said, if you practice long enough, you will run into some significant complications. I was like, "No, God, please."
Yes.
But no,
Yes.
I never had one that just, let me knock on wood. Y'all gonna jinx me.
No.
That just made,
Don't
because
do it.
Got it.
Don't do it.
mainly because I know there's always help. You don't have
Yeah.
to be a cowboy.
That's
I
it.
got my partner. I don't have a problem saying, "What you think about that?
Yeah.
What is that?" Or
Right.
I'm like, "You know what? Call me a surgeon in here. Call me, because I don't know what this is."
Mm-hmm.
So no, that's not, that's not typical.
Oh my gosh.
Mhm.
So, Michael, I don't know if you had
Oh.
a question that you were waiting to,
Uh,
but I had one more.
well, no, I mean, I'm, I was telling Dr. Johnson earlier that I was saying, interestingly enough, I, so during my career, my father was a general surgeon,
Yeah.
and I love surgery, and I tried to get into general surgery residency, and I said, I guess the Lord is telling me something, because I don't even think I got one interview, so, but I do love primary care. I love what I do in hospital work. But before I went to med school, I was a surgical technologist. And, for those who don't know, those are the people who assist, the surgeons in the operating room. They prepare the operating room. They get the suture. They get all the different instruments together, and they organize, lay them all out. And so when Dr. Johnson comes in the room and she's ready to go, the tech is the one that's assisting her and retracting and making space when they get the baby out. Anyway, so I worked at a women's hospital in Orlando, and I said, man, this is awesome. And I have, really kind of mastered those surgeries. They were doing hysterectomy, LEAP procedure, cerclage, partial. They were doing transvaginal hysterectomy, all kind of different things, and DNC. And I said, well, I really felt like I mastered, and I, really enjoyed this. And then when I went to med school and I saw it from the doctor's perspective, I said, oh, hell no. There ain't no way. Look, you see what happened, Melanie. You see what happened to her tonight. You see what happened today. She called. She was texting me
Yeah.
saying, "Lord, I had these emergency." I said, "Dr. John, she can't even get on here with us because she got a doggone surgeries to do and see, I can't do it. See, 5 o'clock, 6 o'clock, we relaxed, we chilling. So no, ma'am. So anyway, that just
God bless you
no,
all who do it,
yeah.
because Lord, when I
I
think
thought
of
it was
surgery,
funny.
I get dizzy.
Really.
I don't even want
Oh,
to think about
Yeah.
it. Woo.
bless your heart.
Let me go to a couple of questions. I was rewinding. So Reva
Yeah.
said one. Reva said one about why didn't they? Oh, okay. I was just going back. I think that was on your previous, Dr. Johnson, when you were talking about the challenging cases, about the one where they were digging around to find the baby, and Reva said, why didn't they just cut it up? Yeah, I think that was on the previous. Yeah. So okay. I
Mm-hmm.
think you had addressed that one. Okay. I'm just getting caught up here. Corinne Stimley says, how do OBGYN feel about the use of saw palmetto and other holistic vitamins to affect hormonal concerns during menopause? And yeah, that's it. So how do OBGYNs feel about saw palmetto, the use of saw palmetto and other holistic vitamins to affect hormone concerns during menopause?
Am I
Okay.
right side up?
Yes, you are
Okay,
perfect.
okay.
That is a good question, Reba. I
Uh,
agree. That's a great question.
yeah. Saw palmetto, and
Great
well,
question.
those are all natural thing. And I mentioned that earlier. I don't have a problem with any of those things that are all natural, holistic treatments, managements. I definitely think there were try. I do now. I can't speak for all OBGYNs, but most OBGYNs who are MDs probably would say it ain't gonna do no good.
Right.
It ain't gonna do no
Right.
good. However, I'm a firm believer. Let me
Great
tell you
question.
something. Jesus Christ is the ultimate. I'm a treater.
Yeah.
Okay. I'm an MD.
Hmm.
Doctors treat, God heals. Do you understand? So I
Thank you.
Ah.
can't tell
Thank
you,
you.
doctors
Thank
treat,
you.
Mm.
Yes.
God heals.
Say it.
So
Yeah.
Say
I
it
can't
again,
tell
Doctor. Say
you,
it again for the people in the
doctors
back.
treat for the people in the back.
Yes.
We treat, God heals.
Heal.
That's
Period.
right.
Okay.
Mm.
Period. And
Mm.
I'll say this just to kind of brag about myself. When I do C sections or history, whatever incision, the nurses on the floor always like, "Oh my God, I knew that was a Dr. Johnson incision. She does the best incisions." But what I tell my patients, I say, "Your incision is beautiful, girl. Who did that?" But I also tell them, "Look, I can't take all the credit. It's the way you
Hmm.
heal. I mean, because I could do the best incision, make the best incision, close up as pretty as I want.
Yeah.
If your skin,
That's right.
your nutrition, your nutritional state,
Yeah.
your habits, if they're not up to par, you may not heal as well and
Mm.
just mess up my incision." So
That's
anyway,
right. That's right.
so
You.
anyway, to say that I don't have a problem with patients trying all natural holistic stuff. Because look, where did medicines come from?
Hmm.
Yeah.
Plants.
That's plants.
Back in the day,
Plants.
where did they come
Hmm.
from? These, what they used to call them, they were osteopathic
Yeah.
treaters,
Yeah.
living in a
That's
tribe.
right.
These, I
Hmm.
mean, I don't want to call them witch doctors, but some of them were, they went and they did natural stuff to
Yeah.
treat, and they treated.
That's right.
So I don't have a problem with patients trying whatever they feel like they want to try that may be natural,
Yeah.
Right.
Mhm.
Well, and, I'm glad you brought that up, Dr. Johnson, because my mother, for those that also that know me personally, they know that my mom was upset with me probably for a couple of years because she said, well, my mom had 4 back surgeries, and she was saying, well, you had the doctor, you got me there somewhat kind of late, or like, kind of, because you know how y'all want them there to pre-op, a couple hours before. So they wanted her there like 5:30 in the morning. We didn't get there 5:30, maybe closer to 6 something. I don't remember, but she said, I think the doctor, that's why I didn't heal, and this and that, because the surgery didn't go right, because you done made the man nervous and all this. And I said, Mom, I said, I talked to the orthopedic surgeon and everything. He said everything went well. He was certainly not nervous. Everything went well, and it was all about your body and healing. And I said, at your age now, it's going to be different than even the patient that Dr. Johnson operates on, who are, delivering a baby of a 20-year-old, or a hysterectomy on a 40, 50-year-old, or something else on a 60-year-old, versus, being in your 80s. It's your body's going to heal. And just, like you said, medically, everybody's different. Somebody else might have taken the same surgery, and maybe their bones would have fused differently, or they would have
Right,
taken to the titanium rods and screws.
right,
So anyway, I'm glad that you mentioned that, because you could even, like you said, I've seen, when I used to assist those guys, I've seen some beautiful incision where they used the straight the Keith needle,
Keith
and
needle.
they closing up every layer, and they going, man, beautiful. But if somebody keloiding, I mean, you know,
Right, right,
Oh my
yeah.
right.
goodness. Ooh.
Melanie, did you have one? Because I'm seeing a couple things coming in on. Well, no, that wasn't a question.
Um,
No, somebody said
well,
thank you for your response. They said, okay.
I was going to ask about C-sections because it seems I've heard more of my friends and just people over the years. C-sections seem to just happen so much more often now than I recall. Is there a reason, or is it okay? I don't want to sound crazy, but I gotta say,
Go
is
ahead.
it because it's just easier and you can get patients in and out? That's what the lay people talk about.
Right, right.
So
Yeah.
Well, there is a push. Actually, it's funny that you should mention that. There is a push on by some of these insurance companies for doctors to decrease our C-section rate. Like we've been just
Mm,
having meetings and discussing that. Now, I will tell you, Lord, I'm not trying to throw anybody under the bus.
mm,
We even joke sometimes. Oh,
mm.
they're gonna cut her because it's 5 o'clock. They ready
yeah,
to go. but but
yeah,
now, but now, here's the thing. The rate has gone up over the years. It definitely has increased.
Mhm.
And
Right.
as doctors have become or always have been very proficient at doing them, doctors have also become very impatient.
yes,
Okay. I mean,
Yes.
you can labor somebody for
Yes.
12, 14, 16 hours. Now,
Mm,
I'm going to put a pitch out there to say for my group and my doctors that I practice with, I think 10 or 11 other women. Okay. We all share call. Um, we don't our C-section rates are as low as I think we can get them. Okay.
mm,
Some of us have stayed out, not on call, like me tonight, not on call. My patient is laboring. If I really feel like she can do it, I'm gonna wait until she
don't
does
wait.
it.
yeah,
I'm gonna wait. I've been at the hospital 2 or 3 o'clock in the morning, not on call. I could have left her, but she's my patient. I feel like she can do it, and I'm gonna
yeah,
wait. Okay.
Absolutely.
So I feel like the doctors that I work with, I can't speak about all the other ones.
yeah,
I feel like we really try to give these patients a chance to labor these babies, especially a
yeah.
first time mama. First time mama, it's gonna take time. I mean, you just be prepared to wait,
Mhm,
you know. But if you prep it right the night before, get that cervix right, get a good start in the morning, then usually they should deliver, before the sun goes down. Yeah.
Hmm.
So,
That's
but to your point, I will admit, in my career, in my profession, there are those doctors who I ain't waiting.
yeah,
yeah.
I got a plane to catch. I got somewhere to be. I got something to do.
Well,
You
yeah.
know, they may not have partners that they can leave
you
them
know,
with, and the patient's making very slow progress.
They
So
take
that's
the
the
back.
sad, yeah, that's the sad part of it.
Yeah,
Yeah,
you
not that it's
you
easier.
Dr. John.
Vaginal delivery is always safer for the
Hmm.
mom. Okay, for the mom. It
okay.
may not always be the safest thing for the baby, but for
Oh,
mom, that's natural. That's the natural way God meant for us to have babies is vaginally, but it's not always the safest way for the baby for sure, and sometimes not for mom.
I got one.
gotcha.
I got one there, Doctor. That was very interesting and real quick. I was going to ask you a question, but Karima Stimley says this has been amazing. I definitely plan to turn on the turn. I definitely plan to tune in to future on this live event. next Tuesday. Thank you so much, Ms. Stimley. And please, and if you plan to tune in, please, hey, like they say at the church, bring a friend. If you plan to tune in, if it blessed you, then that means it's gonna bless somebody else. So tell a friend. And look, next month is Breast Cancer Awareness Month. Dr. Johnson and I talked about that, and she has a partner who that is their area of true expertise. And so perhaps this particular physician may join us. Perhaps Dr. Johnson may come back and join us. And again, we want to let you all know again that on next week, on the next Telehealth Tuesday, so help me God, we are going to be on a different platform. We've got one that we're already working on. Going to be very easy for everybody to log on, and our distinguished guests. So, real quick, we got some other comments. Dr. Johnson, I wanted to ask you, and this is going to be a controversial one, but hey,
Okay.
it's me and you we're talking about, so let's get controversial.
Okay. Okay.
When it comes to the treatment of African Americans, and I know I saw Dr. Justin Turner was on here earlier. He shout out to Dr. Turner in the Mississippi State Department of Health. And you know, we had just come back from our symposium in the Choctaw. So anyway, we were talking about issues that affect Black people, and Black people more even than other ethnicities and races. And so my question is, do you feel like, or I know the answer to this, but do you feel like, and have you experienced in your practice, that when the ladies come to you that have either been to either other doctors of a different ethnicities or descent, uh, that they are disproportionately treated differently, or I would even say their care has been worse as compared to other? I'm comparing African American patients to others. Has that been your experience or not?
Uh, Let me preface this by saying this again. I am in a call group with about 12 OBGYNs, all females, all women. 3 of us are of African American descent.
Mm-hmm.
I can honestly say to you that I have had partners in the call group to come up to me to ask a question about a patient, like just a kind of sidewalk consult about things. And I wait. I used to. I don't anymore. But you know, when I first started practicing, I used to wait to hear if I could tell if they were talking about a white patient or a Black patient, or you know, a Black patient versus another ethnicity patient. And honestly, I can tell you that I didn't. I didn't appreciate a difference in what they thought they should do as far as managing, what they said to the patient, what the conversation was with the patient. However, during this whole Black Lives Matter, because I was in a bubble and I trained at a very diverse residency. We had Indians, Asians, Thai, you know, patients, people, residents from Thailand. So again, I was in a very diverse population. Then I come to this group that is mixed, Black and white, and they all seem to treat patients the same. However, I realized during Black Lives Matter how disillusioned I was just from hearing so many, reading so many articles and seeing so many different bad outcomes when it came to women of color. Now, women of color, no doubt, we have a higher maternal death rate. We have a higher fetal death rate. We do. So I don't believe that all Black people, especially women, don't seek care. That's not the case. So there has to be something else as far as they're not being listened to.
Mm-hmm.
They're not being heard. And here again, I don't want to make it a totally race thing, but we speak a different vernacular.
Absolutely.
I can look at a Black woman.
Absolutely.
A Black woman can look at me. She can look a certain way or say a certain thing. I'm gonna know exactly what she means.
Right.
That means she pissed. You know,
Right.
another ethnicity
Right.
may not know.
Yeah.
He's just hearing her words. He or she is just hearing this woman's words. I can read her. You see what I'm saying? I know what she's saying, and vice versa. She can read me. She know what I'm saying. She know I ain't liking that, or that's not jiving, or yeah. So I think there is a difference in communication. I hate that, but there's a difference in communication. And when we communicate with other ethnicities that may not communicate the way we do, they may not hear you the way we do. Okay?
Yeah.
ACOG, which is the American College of Obstetrics and Gynecology.
Mm-hmm.
That's like the OBGYN Bible. That is who
Right.
credential us. That's who we have to get credited by. That's who we have to prove that we know what we're doing. They came out with a statement in 21 that said black black patients, black women are more likely to survive when they're taken care of by black doctors. And I was like,
Yeah.
oh
Yeah.
snap.
Yeah. I saw that. I remember reading. I saw that. I
Mm.
saw that.
Oh my God.
Now
Absolutely.
that's
Yeah.
interesting.
Yeah.
Yeah.
Absolutely.
They caught a lot of flack for that. I actually felt bad for some of my partners who are not of the black, because I know they were so offended,
Yeah.
but
Yeah.
Right.
you can't deny ACOG does
But
their
yeah.
research, they do stats, everything is based on stats and numbers.
Right.
So
Yeah. The
you
objective
can't deny that
information.
there's something going on.
Well,
Mhm.
and I appreciate that, and you're right, because I remember that was a hot topic there.
Mm, yeah.
And that's been my experience. And like you said, I'm not saying nobody is certainly not trying to race bait or nothing like that,
Mhm.
but it's just like you said, you can't, and that's why I mentioned Dr. Turner. I remember that he did a talk on that around that time, I believe. And so you can't deny it, and it's been especially apparent in Mississippi. And like we said, I won't name the particular hospital, but again, those that know me personally know that I didn't. I know you don't know this, Dr. Johnson. I didn't mention this to you, but at this particular facility, there was a cardiologist, and for those who don't know, that's a heart doctor, heart specialist. There was a cardiologist who was there, and then when elderly black people would come into this facility, this was just last year, and the early part of this year, they would come in with a heart attack, what we call an STEMI, and that when people come in with chest pain, shortness of breath, sweating, elevated cardiac enzymes, and all that, we get concerned for an STEMI or heart attack. So we get the cardiologist consulted, we get him on the case, and this gentleman, I don't have the stats on this either, but I would venture to say 75% of the patients that came in with what I felt was a heart attack, he said, I'm not going to do anything for these black folk. He didn't say for these black folk, but these are black people, and he's not. And he said, I'm not going to do anything. I'm just going to, if he was like, Dr. Bookhart, if they survive, he said, first of all, look, let's think about it. The patient is old. I mean, they've lived their life. If they
Mhm.
survive, they can see me in the clinic, but I'm not going to do it. And I said, Dr. So-and-so, I said, come on, sir. We can't do that. We need to take care of. And one other thing, another patient who had been a long time drug abuser. He was only 47, and he'd been on crystal. He'd been on cocaine. He was using marijuana and one other drug. I can't remember if it was spice or heroin. Anyway, the bad stuff. And so
Mhm.
he had basically he came in with intense chest pain. He had been passing out, and his heart was going into a very dangerous rhythm, which can be a deadly rhythm if you stay in this particular rhythm, it can kill you. So he
Mhm.
came in with this rhythm. I got cardiology on board again. And basically, this gentleman qualified for a defibrillator, which is a device that they put underneath the skin. A lot of people, your grandparents and other people, you probably know about it. It's a little thing, and you can feel it under the skin. And this
Mhm.
device is supposed to be a life-saving device. Just like when you see people say clear, and they shock them, boom, in the movies, and the body go like that. This
Yeah.
this device is in the chest, ladies and gentlemen, and it is to save your life. This gentleman qualified, 47-year-old black man. The same cardiologist says, well, I said, Dr. So-and-so, this guy needs this device like yesterday. He
Mhm.
says, well, Dr. Bookhart, I'm not going to put a $250,000 device in a drug addict. And I said, Doctor, yeah, Doctor So and So.
Oh
I have talked
my
to this man
God.
till we were both in tears,
Oh.
and I said, this man has two little kids. I don't know at his home, but he has two small children, and he
Oh.
has cried. He has called out to the good Lord and said that I will never do this again. And he never knew. No doctor took the time to explain to him what's going on and that he's gonna kill himself and you're gonna leave these poor kids with no daddy. So this
Mhm.
man, I said, I believe that this man had been delivered. And he said, again, he said, if the guy survives and if he doesn't do any more drugs, I'll be glad to see him at a later date. So anyway, those are my two stories, and so it just kind of that was something that really, yeah, it really bothers me, and I was fired up. And so of course, you know how it is when with a whistleblower and somebody who does the right thing, they're gonna get rid of you. So, yeah, that had been my. All right, so real quick, let's go back to these questions. I know we probably let's see. I think we started at 7:36 or something like that. It's 8:27. So let's give it about 10 more minutes. I know this is such a great episode. Somebody said, why, I think this was an old comment, why not just induce labor instead of performing the C? When you were talking about the C-sections 10, 12 minutes ago, this person had asked, why not induce labor?
We induce labor all the time. I mean, we don't just do C-section straight off the bat.
Right.
Usually when these patients have C-sections, it's because they've labored for, however long, did not progress, or baby didn't tolerate it, or mama says, I'm done, I'm too sick of this. No, we don't just, we don't just do a C-section. C-sections usually happen because of the patient failed labor.
Okay.
Like they failed the trial of labor for
Exactly.
whatever reason. So that's kind of, no. We don't just do C. Now, ACOG says that a woman can come in and request a C-section. She doesn't even have to labor, and I don't like
Okay.
that, but they do. They do.
Yeah.
Yeah. So anyway.
Yeah, I've
Mhm,
heard.
mhm.
Okay, yeah, somebody, yeah, chocolate, yeah. Chocolate Sunday said, yeah, and so this person had said that after that question, or the patients request them because they have things to do. I heard somebody say that.
Uh-huh.
Okay,
Well,
and then we
no,
have,
there's a such thing. Let me just say this. Patients request it sometimes because of pelvic preservation. If you could see the trauma, I saw a
oh
cartoon
yeah,
once of the trauma that's done with a vaginal delivery. I mean,
oh
many
yeah,
women, most women who've had at least one or more babies, we gonna be tinkling on ourselves years later when we cough, sneeze, or laugh. Like that pelvic floor really takes a hit from vaginal deliveries. So that's why ACOG came out, probably about 10 years ago now, and said that women can request a primary C-section. Mainly it's for pelvic preservation. So, yeah.
great points there. Anitra McGee says, what advice do you have for women who have it's kind of see the letters. You got the white scrubs, the letters that when they go across it. Can you see that, Melanie? A little bit. Anitra McGee, what advice do you have for a woman who has had tu, a
Oh, a
tubular done with, yeah, with a
tubular done with.
procedure? Uh huh.
Oh,
Go
you,
ahead, Melanie.
you want me to do it?
Yeah.
Okay. Uh, okay, yeah. What advice do you have for women who have had a tubular done with a procedure slash device that has been removed from market? Should we have it removed? Uh-oh, my screen just went off.
Uh,
My computer
yeah.
died, right?
I know what
She said, yeah. Should we have it removed, or is it a case by case decision?
it's a
Thank
case by
you.
case decision. That's a very good question. She's referring to the Escher device. I'm
Oh, the
assuming. I would
insurance.
think.
Yeah. Yeah.
Escher was a device where we could do a tube, we would go in through the uterus and put these little coils in. They were made of some type of material, metal that does not cause a problem. But we would plug up the tubes basically. We put it in a tube, it expands, and then the tube scars around it. It was on the market for, I don't know, less than maybe 5-7 years, and
Yeah, I
then
remember
they
that.
recalled it for multiple reasons. But if you have one, because I did them, I haven't had a patient that I know of that's had a complication from it. But if it's there and you're not having a problem, it's not bothering you, leave it alone. Leave it alone.
Mm-hmm.
Yeah. It would cause more damage to go in and try to remove them than it would to just leave it alone if it's not causing you a problem.
Okay.
Yeah.
Yeah, that's good.
Mm.
Chocolate, that's great, great answer, great advice. Chocolate Sunday again says, I've experienced that so many times with black patients. So yeah, she was talking about what we were talking about with being kind of, disenfranchised, being
Right.
black people. So she's experienced that. Okay, I think we got caught up there. Um, okay, I think we're pretty caught up there. Melanie, what you think? We got it at 8:32. Any look? So somebody, Anitra said, "Oh, thank you for." Okay, yeah, thank you. She said, "Thank you for answering that." Does anybody else out there? This is the last. Well, I think we got about 5 minutes left. We got 5 minutes, ladies, and it was mainly ladies. So ladies, we got 5 minutes. If anybody has a pressing question, please ask it right now. Man, Melanie, what you think? This has been so informative.
Yeah,
Man,
I mean, this is
it's
really, it's just an honor to have you
absolutely.
to be here with us and take your time to answer these questions because it's challenging. I mean, being a woman, well, you are a woman, obviously, but you know, you have a higher knowledge of the body and things. And like I say, lay people are like, oh my gosh, what is going on? And
Mm,
every doctor is not the same. I mean, you know,
That's right.
the
nope,
care is not
nope,
the same.
it is not. It is not.
So we
All doctors are not
appreciate
the
you.
same.
Yeah, because
Absolutely.
you really genuinely love and care about your
That's
people.
Can you
so
tell?
rare.
I'm
I can
So
surprised that
see
my
rare.
it.
patients are
Oh
on
yeah.
raving because I
Oh yeah.
absolutely love my job. I actually love my career. It's not a
Man,
job.
that's
It's my
Yes.
life.
Yes.
From the
that's
Yes.
time I was 5 years old, I knew I wanted to be OBGYN. Like I
awesome.
tell patients sometimes, if I were to hit the lottery, I think I would still work.
Yeah.
Maybe not as much. Like I wouldn't be out there doing a C-section yeah. But I would
Yeah.
work. I love what I do. And ministering to women and teaching women about their bodies and
Yeah.
empowering them that if you go to another doctor and they can't break it down to you, my thing is always explain to me like I'm four. If
Mm.
that doctor can't
Yeah.
do that for you, then you need to leave.
Hmm.
You need to have enough information to
Absolutely.
be able to ask questions. Okay.
Yeah.
Absolutely.
You need to ask your question, and that doctor needs to be able to take the time to answer your questions. Okay.
Yep.
Yes.
Period.
Absolutely.
You're
That's right.
paying them.
Right.
Your
Right. Right.
insurance, you're paying them to provide a service for you.
That's right.
Yeah.
So it is their job. And then we took an oath to do no harm, but you also need to educate your patients, you know. No
Mhm.
doctor should ever get offended because you're asking questions. They should
Right.
not. You at the
Right.
wrong doctor. If you feel
Yep.
like you're being rushed or you feel like your questions are being poo-pooed off, you with the wrong doctor.
Mhm.
Period.
That's right.
Okay.
That's
So
right.
that's the way I
Period.
feel.
You heard it.
Thank
Look,
you.
Period.
I
Thank
look,
you.
Period.
look. Hey, I look. Chocolate Sunday has come back with a question, but I want to stop and let you do a plug for Lakeland Premier, Dr. Johnson. Would you? I know everybody knows Dr. Temeka Johnson, but who for those who don't, would you please tell us where you are located and if y'all are taking new patients or not,
Yes,
please?
I'm located at Lake. My office is called Lakeland Premier Women's Clinic. We are three females. We just happen to be all African American females. We've been practicing, all of us double-digit years. I've probably been in private practice about 22 years at this
Wow.
point. My older partner's probably been practicing closer to like 27, 28. The younger partner definitely maybe about 20, 19, 20 years in private practice. Um, we initially were with a bigger group, multi-race group, or different race group, and no harm, no, I still love all of them. The separation was a business decision, okay?
Yeah.
And it's been a good decision. I love medicine. I don't care where I am. I could practice in a mailbox, so it wouldn't matter. And so for me, it wasn't a matter of location or whatever. But anyway, we are three females, OBGYN. We have all ancillaries, mammogram, sonogram. We do, deliveries. We do GYN surgeries. We do, hormone replacement, birth control, anything that has to do with a woman's health, we deal with it. We don't do breast biopsies, but we deal with the breast. I found several breast cancers. I found a lump, I investigated, I sent it on to a breast surgeon. So
Mhm.
most women, the only doctor they have for years is their OBGYN. So they come to us for toe fungus. I'm like, girl, I'm not no, girl, no. This me. I'm from here to your bottom of your thighs. No, ma'am, I don't want to look
Yeah.
at your toes. But but I
Lord
will
have
treat a
mercy.
toe fungus because I know how to
Yeah.
do it. You know what I
Yeah.
mean?
Yeah.
I'll
Yeah.
do it.
Yeah.
But I'm like, I'm gonna do this one thing, and if it doesn't work, you go into a specialist.
Yeah.
So anyway,
That's
my
I
group
love
is
it.
Dr. Sullivan Ford, Dr. Natasha Hardiman, and I am
oh
Dr. Tamika Johnson.
That is
And
wow.
we
so
are located at
awesome.
2506 Lakeland Drive, Suite 600. We're in the top floor.
That's it.
We on the suite. We got the suite, right,
Y'all got the
Michael? We got the
got the
suite.
y'all
Okay.
got the
View of the
penthouse
whole
suite.
city. Like we can see St.
Yes.
Hey,
Dominic's, we can see the university. We got the whole
look,
floor. There's no
Oh,
other
they
office in that building that is the side. We took the whole floor.
the whole
The
look when you
whole
get off
floor.
the elevator. Look, I'm suite 310. I took the third floor. I've been in I've been in practice for 12, 13 years now. But in private practice, my own clinic, this is first year. But I, I said, man, the good Lord has blessed us. We on suite 310. We next to Dr. Joyce Wade. We come off the elevator. I said, man, we got a nice glass door, beautiful writing. We feeling good. Man, I went up there to sixth floor, Melanie. They got a
Uh-huh.
doggone waterfall coming down. They on the
Oh,
penthouse suite. I thought I was watching Power and Ghost and Tommy
yeah.
finna come out of nowhere.
Stop it, stop
They on
it.
the penthouse.
Yeah,
Look, I am definitely coming to. I'm coming by. I'll be visiting very soon.
yeah.
Yeah, yeah. You had I don't know if you want to. Melanie had, you can share it if you want, but Melanie had asked a question, or I think you made a statement about personal, and you were thinking about some
Oh,
fertility. But
diabetes.
I'll let you.
Mm-hmm.
Well, no, yeah, because I think I took care of the diabetes question,
Oh
but you
yeah.
were asking about the
Oh, the age.
fertility and age and fertility.
Uh-huh. All that,
Yeah.
because I'm 40, I'm 43, about to be 44. I have no children yet. And I have gotten to the point where I'm like, okay, I need to sit on down. Okay. And so, and I'm like, Lord, everybody like, hurry up, hurry up, hurry up, hurry up. I'm like, okay, okay.
Let, let,
So yeah,
let me give you a word of encouragement. And this is what I tell every patient that comes in there saying what you said. And during COVID 2020, I delivered a 47-year-old.
Wow.
47. She had a miscarriage the year before, turned around and got pregnant next year, full term, no problems, no genetic abnormalities, vaginal delivery, like nothing.
that
So
is awesome.
I tell patients, as long as you still having a
Yeah.
period, you can get pregnant. You can get pregnant.
Okay.
Oh yeah.
Okay.
Oh yeah.
Okay.
Yeah. So
And she was
don't
47. Oh my gosh.
47.
And
Don't
they
be
always make
discouraged.
you feel like your baby, something's gonna be wrong with your baby. Oh, I'm like,
No, no. A lot of my patients are 40, 41, 42, 43. First baby, 42, then the
That's all
next one
right.
at 42. Yeah.
Yeah.
oh, they get another
Um.
one.
Yes. Probably
Yeah.
a third of all my OB patients are at what we consider advanced maternal age. That's 35 or older. But if you're healthy, you're in good shape, ovulating, having cycles, you need a sperm and an egg, have a baby.
Boom.
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 Okay.
Boom.
Boom. Look, that is awesome. And Melanie, I'm gonna give you a chance for a plug. This is the last question. Chocolate Sunday has put the question 3 times. So okay. What are other treatments for fibroids, or is having a hysterectomy? Well, you covered this, but is having a hysterectomy the only treatment? We know it's not, but
Well,
yeah.
make this real quick. There, you could do conservative. Okay, watch it, manage it, watch it. Medicine, medical treatment, birth control pills. There's other medicines on the market now. My Fembry, I'm not associated with any of those companies. I'm not getting any money from them. But there are medicines on the market now that can control the bleeding, potentially even decrease the fibroids. They are not treatment. They are just management. They're like Band-Aids for somebody who maybe can't have a surgery, don't want a surgery. So you got
Oh,
medical management, then you got surgical management, which would be myomectomy, and then you got hysterectomy. Now, there are other options that people probably heard about: uterine artery
Yeah.
embolization, some type of cryo. I'm not gonna comment because there may be some people out there that do those. Not a lot around here. I'm not a big fan of those. I did 2 hysterectomies this year of people who had those procedures done. Uterine artery embolization, still bleeding, still hurting, and whatever the freeze is, I don't know. Still hurting, still bleeding. 2 patients, okay, back to back. So I'm not a big fan of those fancy things. Those to me are reserved for people who, say they got severe heart disease, morbidly obese, can't have surgery. Then yeah, try uterine artery embolization just to decrease their blood flow. But if you're young, healthy, there's plenty of other options: medical and then surgical, basically.
Okay.
Okay.
and those medicines
Awesome.
that you named, those are medicines that, of course, the doctor has to prescribe,
Absolutely.
right?
Absolutely. Those are prescription drugs.
Okay.
Awesome.
Yeah.
And then Anitra McGee said, I had the pleasure to have you um, as a provider. I had the pleasure of having you as a provider some years ago when I was a resident in Jackson. Dr. Johnson, you were very professional and adequate with my treatment, and I thank you for that.
Oh, thank you. Thank you.
Uh,
Thank you.
Melanie, would you let us know what you got going on and what you're working on and how we can support you?
Okay, well, I am first of all, Lux Life PR, everybody, public relations. You can find me at luxlifepr.com or on Instagram at Melanie N. Sanders. I'm just, I'm just working for other folks.
Yeah.
And I've also I've become the talent too. So I'm working with talent and then I'm the talent. I'm doing a couple of things, TV things. Of course, I've been hosting events around town. Let me think, what's coming up? Oh, the Qs are having something in October, and I'm so sorry, I just blanked out. I don't even remember the date. So if you're interested, just go to my page because I'll be, just keep up with their way. But after that, I'm gonna be singing, which is my first love. Getting back. That's how I even got started with public relations, all that. I was, the talent. And so I'll be at the artistry on October the 11th doing my first gig in like 10 years.
Wow.
It's going to be called Uncork. It's a wind down Friday evening. So that's on October the 11th. If y'all like wine, you like to chill, come on through. And I'm going to be singing some tunes.
Nice.
Trying to get back. This is therapy for me. I'm not trying to be famous and all. I'm doing it for me.
Right. Right.
Dr. Johnson, she said she ain't trying to be famous. She got what 15,000
I know.
followers
I know.
already,
She's
and
small.
She's famous. She's
well,
celebrity.
I know. Well, but and then I go to the Essence Festival, and she hosting something over at Essence. The Essence Fest. I think I don't even. I mean, one year, I don't even think Melanie could fit Essence in or some event on her schedule because she was already at it. So we appreciate the modesty.
Oh,
Thank
Um,
you.
thank
well,
y'all.
we thank y'all so much for coming on, Dr. Johnson. We really appreciate your time. I know you're tired. I know you're hungry.
Yes.
Uh,
Thank you
we
so much,
so
Dr.
Thank
we
Johnson.
thank you
y'all.
and
Thank you.
Lakeland Premier Women's Clinic. They're in the same building, and as us, we thank you, Melanie, again for a great
Thank you
episode.
for
I know we had a little,
having me.
yeah, absolutely. I
Yeah.
know we had some technical difficulties on there, but folks, again, we are going to have a different platform. We've already got our marketing team. They're hard at work right now.
Thank
And so we will let you know what it will be. So that way it's going to be 6:59 and we're going to be on there. And
Oh,
so you will see, but it's just been such a blessing. This is episode 5 of Telehealth Tuesday. My name is Dr. Michael Bookhart. I'm with Good Faith Wellness Center. We're located at Suite 310. We don't have a waterfall. We don't have the penthouse suite. But we do have a beautiful brand new office. We are here. We have Dr. Torrance Green. We also have Dr. Sophronia Stidwell. And we have a wonderful staff. We are doing in-house labs. We are going to be offering IV hydration. We're going to be offering medical marijuana soon, not right now. And we're here for all of your primary care needs. We are people who do definitely care about you. You heard Dr. Johnson. You've seen her dedication. You hopefully have seen our dedication. Melanie's here. She's shown her love for the community. So we thank you. This is Telehealth Tuesday. We will see you every week, always on a Tuesday at 7:00 p.m.
thank
Central
you.
Standard Time. Stay tuned next week for a very special guest. You never know who it's going to be. And remember, true wealth begins with good health.
thank
Mm,
Bye for
you.
that's right.
Thank you so
Thank
much.
y'all.
Good
Yes,
night.
thank
Thank
you.
All
Good
you.
right.
night.
Night.
Thank y'all.
Bye-bye.
Bye bye.
Bye.